Hi, welcome to Sandy Says. My name is Sandy Dimiterchik, and I'm the Director of Community Engagement and Board of Directors member for the nonprofit Schizophrenia and Psychosis Action Alliance. Today, I will be interviewing Maggie Mullen, author of the Dialectical Behavior Therapy Skills Workbook for Psychosis, which was published this year. So Maggie, if you would mind, go ahead and introduce yourself and your qualifications.
Absolutely, and thank you for having me, Sandy. So my name is Maggie Mullen. I'm a licensed clinical social worker. I use they, them pronouns, and I am somebody who's worked with psychosis for the past decade or so, and in the form of providing sort of mental health services, therapy, group, individual work, and I've also published a book, as you mentioned before, on the same topic. And I also do trainings in the community on more effective work for folks who are experiencing psychosis.
Well, thank you so much. How do you define recovery? What do you think of the definition of recovery in our Blue Book? The most obvious sign is the reduction in control of symptoms to the point of permitting one to have the ability to find and keep steady and structured activity on page 24 of the Blue Book.
I love that we're starting with this question because I think a lot of the conversations when it comes to schizophrenia or to psychosis in general often overlook the idea of recovery. It's just sort of focused on symptom management, for example. So I really like the definition that you all provide around recovery. And I think the only place that I would sort of expand on it personally is that I think recovery means something really different to every person, right? For some people that I'm working with, recovery looks like they are still regularly hearing voices and still having some symptoms, but they are less impacting or less impairing, I should say, on their day-to-day functioning. So essentially being able to live a meaningful, sort of purpose-driven life as a way, as kind of the measure, and however your symptoms or your psychosis is showing up, it still allows you to have that experience that I think is so important for us, feeling like we're having lives worth living.
In fact, on your book, it says, manage your emotions, reduce symptoms, and get back to your life. I really like that.
Yes, definitely.
Okay, and what is the difference between CBT, P, and DBT for psychosis?
So I am a huge fan of both of these treatment modalities. So essentially, they're both forms of psychotherapy, and CBT for psychosis stands for cognitive behavioral therapy for psychosis. And CBT has been around for decades. It's been very popular since probably the 1950s. And it is more focused on the beliefs that we have, right? The ways that we think. And for people who experience psychosis, we tend to get stuck in sort of distorted thought patterns, right? Where we have distressing thoughts, intrusive thoughts, maybe even suspicious thoughts. And CBTP is really focused on helping break up that kind of rigidity that can happen with those thoughts where they feel very stuck and very hard to kind of doubt. And DBT, on the other hand, so dialectical behavioral therapy, is focused a little bit more on the B part, meaning behaviorism. So where we're focused on the ways that emotion dysregulation, or the way that emotions, when they get really overwhelming, when they get really strong, how we can use skills to break that up so that we can still think clearly, we can make effective decisions, and essentially, again, lead a life worth living. And I think both CBTP and DBT tend to work really well together in tandem because they target two really important parts: thoughts and behaviors and emotions.
And why did you decide to write the book?
So I decided to write the book because I felt like there was almost no literature available to people who experience psychosis. They're really, like, when you look on Amazon or wherever you buy their books, there are almost no books that are meant specifically for people with lived experience. There are plenty of fantastic books for people, family members, mental health clinicians, psychiatrists, whoever. But I think there was kind of an assumption, unfortunately, in mental health for a long time, that people with schizophrenia wouldn't read, that they wouldn't have access to these. And I even noticed some of that when I was sort of launching this book in the first place, is getting that response for people. And what we've learned is that is not true. That is really a myth. And so for me, I wanted to make available to people who either don't have access to treatment, as many people with schizophrenia don't have, or people who are currently in treatment, to use as an adjunct some of the skills that they might learn in therapy or otherwise, and sort of make them available to people. And certainly it's not a substitute for psychotherapy, but it's sort of a way to make some of these common ideas available to the average person who's dealing with schizophrenia.
And how long have you worked with people who have psychosis?
It's been around a decade now. And for me, it has been really a true pleasure. I think it's actually my favorite part of any of my work that I've done in mental health so far.
What kind of research supports using DBT for psychosis skills?
So right now, what we know is that people with psychosis experience this thing called emotion dysregulation really frequently. And just to kind of define that for a second, it sort of looks like maybe if a client comes to me and says, okay, Maggie, I was hearing voices saying really critical things to me recently, right? They were telling me that I was an idiot, for example. And what happened was then I got really upset. I was feeling ashamed. I was feeling angry because these voices were saying critical things to me. And in turn, what happens is when those strong emotions arise, they also impact our symptoms, right? Then our voices might even get worse, or we might even feel more suspicious. And we get kind of trapped in this loop where our emotions impact the way that we're thinking and make our symptoms worse and kind of spiral out to the point where maybe we engage in a behavior like cutting ourselves off in communication from other people, so like self-isolating, or maybe we yell at somebody. We kind of act out sometimes when we get caught in this loop. And so what we know about people experiencing psychosis is this is a really common experience, unfortunately, that's really overlooked. And DBT is a therapy that was developed specifically as an evidence-based treatment to help people break the cycle of emotion dysregulation. And so we know that using these skills are very helpful and very effective for people who are dealing with that same cycle that can come up.
I noticed you recommend working with a therapist or doctor. It can be confusing when to medicate versus using skills. What do you recommend?
This is so individual based on the person. So I don't know that there's a great formula for it, but I think it's about being in consultation, right? So I always tell people that you know yourself best, right? You're the expert on your own experience. And so being able to draw from the idea that, okay, maybe I have written some notes or kind of kept track of what was helpful for me and what wasn't helpful for me in the past, I could use that to draw on. I could also talk with maybe a loved one or my therapist to figure out like, what is the best route for me here? I find that a lot of people really need a combination of the two, tends to be most effective for folks, but there are certainly plenty of times where it can be unclear, and having like a loved one or a trusted person in your life who can maybe, advise you a little bit is helpful. But there isn't necessarily one simple formula, I think, because everyone is so different and we're all in different stages of recovery when it comes to schizophrenia.
Do you think people can reduce the level of their medications if they use the skills you write about?
We don't know just yet. And that's one of the hopes that we, would like to see come out of this. But at this point, I think it's too soon to say based on where the research is at. What I think we do know is that folks with schizophrenia are often over-medicated or really heavily relied on medication only as an intervention. And so I think when that happens, that's like where a lot of our research has been kind of stuck over the last few decades. And so what we do know is that using interventions like CBT for psychosis and using DBT skills in general does help with medication overall. There isn't necessarily a definitive link at this point that this alone would be helpful. So I hope it gets there, but we just don't know just yet.
I think you also mentioned sharing the book with family or friends. Why is that a good idea?
I think of any mental health issue, certainly schizophrenia included in that, as being a journey that a whole group of people takes together, right? There's the person who has the lived experience themselves, but then there's the whole support network that kind of has a ripple effect, right? Like when you're struggling, your loved ones are struggling too because they care about you and are trying to help you through a hard time that you might be experiencing. So I always really recommend any of the resources or any of the work that I do with a client be shared with everyone in your support network that you trust and feel like you're on the same page with, so that they can help reinforce that, right? So like when you're like, I don't know what to do, I'm really suffering right now, they can give you some ideas and kind of recommend some things. And the book is certainly one resource that they can use. I think the other thing is that a lot of the skills that we teach folks who are struggling with schizophrenia are really effective for caregivers too, right? So your loved ones in your life, they help everyone. And so being able to also utilize those skills when your loved one is feeling dysregulated or feeling stressed out or struggling in some kind of way, because they're going to be a better support to you if they are feeling, grounded and feeling good as far as their mental health. So I really like to involve the whole kind of family support network in general. I think the other piece to add to this is we know people who are dealing with psychosis have better chances at recovery when they have a support network, period. And so the more ways that we can kind of develop that, if it doesn't exist for somebody already, the more likely you are to do well, because we are people who are dependent on others, right? That's part of being a human, is that we need support from other people, particularly when we're struggling with a mental health issue.
It's very interesting. Recently, I had a conversation with a family member who, has done everything they feel they can to help their loved one get on medication or get back on medication. And when I mentioned your book, she was like, oh, yeah, because it's about skills. And so because this person has not come to terms with the fact that they need to take the medication. And so she felt like using your book might be a good stepping stone to getting the person's life back, learning the skills, hopefully understanding that they do need the medication. What do you think of that?
I think it's a great resource, I think, to start with. And, I think there are plenty of people who have good reasons to be worried about taking medication, right? Everyone has a very different journey around this, including folks who don't take, antipsychotics or other psychiatric medication because of side effects. I mean, oftentimes it's a big piece of this, or thinking that you don't need them, or, a number of other reasons associated with that. And so I think if the book can serve as a way to kind of just begin thinking about your journey and starting to think about what your self-care plan looks like, what you need, and what's helpful for you, I would feel very happy to have it used in that way. I also feel very proud of that.
And what do you think of the idea that schizophrenia and the spectrum disorders are neurological brain illnesses?
So I am not a policy expert. And that being said, I am somebody who wants to stand behind whatever people with lived experiences are advocating for themselves. Because again, your experience best. And I think the issue is that when we, as neurotypical people or people without schizophrenia, make policy decisions without the input of people with schizophrenia, we don't do very well for the most part, right? We don't lead in the right direction. And so for me, knowing that that's the case, that many people are advocating for things to be shifted to reclassifying schizophrenia as a neurological condition, I'm all for it, especially because what I understand is that it would also unlock and kind of allow us to access more research, more funding for research, for services in general. I think one of the things, to add to the conversation on this, though, is that there are so many limitations to the way the DSM is organized in general, right? The idea that any condition can fall into just one narrow category really limits our ability to treat things. Because at the same time that schizophrenia is certainly a neurological condition, there are behavioral and emotional elements that come with that. And I think when we sort of say like, oh, this trans diagnostic, meaning it falls into more than one category thing, should just be in one box, we then only often provide treatments that target just that one part. And so for me, I think the conversation is, how do we advocate for that? Because it's just the reality of what the DSM looks like now, while also sort of taking a more holistic approach to addressing all the different dimensions that schizophrenia can kind of touch in our lives.
Yeah, I agree with you. I know that when I talk to people, I always recommend therapy. I explain to family members that, the process of, being diagnosed, going on disability, possibly going off a disability, I think there's a lot that you have to really sift through to really come to terms with each of those different things. I think that's also another aspect of living with the condition.
Absolutely. Yeah, I would definitely agree. I think it's a there's room for nuance, right? That we can have a conversation about something that is complex, right? At its best.
What do you think about self-help peer support groups like ours using the 6 steps of recovery based on the 12 steps?
Again, I love peer support groups. I am a huge fan, again, of bringing in folks with that experience to be able to educate their peers, talk about their own experience, because for me, as somebody who doesn't experience schizophrenia, there is a lot of power in hearing somebody's real journey that I'm not going to be able to share with them. I can certainly share from the experience and perspective of somebody who's done this work for a long time, who really cares about it, but it's just not the same, And so I think I for any of those programs, right, what you all are running, what NAMI is running, all these different kind of peer support groups, Hearing Voices Network, I really think there's so much power in doing that type of work. And I feel very grateful that they exist as well.
Yeah, I didn't add this, but what do you think about the peer support specialist movement?
Also a huge fan. Yes, that's something we're actually trying to get at my workplace right now, is to bring that in. But there's, I think a lot of institutional barriers to hire people who don't have degrees, right? Who don't have like licenses to practice, which is, again, I think a symptom of a medical model that really over focuses on a certain way of treating psychiatric conditions that's not really conducive to most people.
Mm-hmm.
I think there's also power both in hearing somebody's experience when you're struggling, but then being the person who gets to give back, right? To be able to share about your own journey, to advocate for people, to kind of be on that other side, that I think is just really meaningful for a lot of my clients who've been through that personally.
Yeah, I know for myself, I'm a certified peer support specialist in the state of Louisiana. And I know that going through the training was just so phenomenal, learning to share your lived experience so that you don't feel so overwhelmed by stigma, including your own self-stigma.
Mm-hmm. Yes, absolutely. And I'm glad you're mentioning the piece about stigma, because I think that's such a huge part of all of this, right? In terms of things that become barriers to access to treatment for folks with schizophrenia, that that folks often don't seek options, not only because symptoms can be very impairing for them, but that they're worried about what's going to happen when they have that on their medical record, or somebody in their life finds out about that, or their employer, or whoever it is.
Right. And I know for us, our support groups, we've got different types, like face-to-face, which we're just starting to kind of do again since COVID, and conference calls and Zoom groups. And I know for me, when I discovered the SA groups back in 2013, the idea that I could just call from my home, and then the idea that I could talk to people who could relate to the symptoms that I have. So yeah, I'm of course, a big fan.
Definitely. Yeah. Well, and I love the piece that you're mentioning too about virtual access, right? That's really not something that I've done in my work until the pandemic. And the pandemic really shifted us in this mode of like, we just need to get people services where they're at. And I wish we had been doing this all along, because we actually have significantly better attendance in our groups than we did in person, even though we were providing people with food and trying to kind of encourage them to come in. There's just a whole step that's involved in transportation, in your house and being around people you don't know yet. I mean, so many things that can be a struggle for people when they are already dealing with some of the, worries about trust and about suspicious kind of thoughts that can come up, particularly at the beginning of their journey.
Mm-hmm. Do you have a favorite skill to teach or use? I got a lot out of the distress tolerance skills.
Well, I am very honored, first of all, that you're using my book, Sandy. I appreciate you sharing that. So my personal favorite is actually a distress tolerance skill that's focused for people who are dealing with substance use or a problem behavior, and it's called alternate rebellion. So alternate rebellion is a skill for people who like to rebel in some way, right? So one of the ways that we rebel as humans is we use drugs, right? We're rebelling against conformity, against an institution, against being told what to do, maybe our diagnosis. I mean, all kinds of reasons that we might use drugs or again, engage in any problem behavior that we're struggling with. And so alternate rebellion says, like, rebellion is awesome, right? Like, we all have rebellious spirits, and it is such an important part of what makes us unique people, like breaking the rules and feeling kind of bad. That's a fun thing. But we want to do it in a way that doesn't come with the same consequences that drug use or another problem behavior could come with. So let's figure out a way to substitute a different behavior that has less potential for harm. So for example, could you, dye your hair a fun color, right? Could you dress in a way that feels rebellious? Could you, do something that just feels out of character for you, like showing up late when you are always a person who's on time, or even sleeping in late, or going to a protest, right? Or one of my clients shares this great example of peeing in the shower, something that she would never do, but feels very rebellious to her. So it's kind of a way to, like, I think, harness that rebellious nature that each of us really has and use it in a way that's going to be beneficial for you long-term rather than harmful.
Well, that's wonderful. Yeah, I really, got a lot out of the book, and I've recommended your book. You're now on our book list.
Thank you. I'm really honored.
So do you do research to support the use of your book, or?
So I am not involved in research. We have done some informal research at my clinic where we've done some kind of outcome studies for the folks who participate in our group to just give us some feedback around what they have noticed have shifted and what they're actually using and what they're not so much, so that we can improve the quality of the work we're providing. But my real hope actually doing some of this is that more people will get involved in the research side, because I think part of what research provides us with is like good science that tells us that something works or doesn't, but also it's an access way to get kind of a channel to funding, right? Like people give money when they know something's effective and has been proved by science in that way. So that's certainly my hope that more of that will continue to happen.
So is one of your favorite role models Marsha Linehan? Is that the name of the person who came up with DBT?
Yes, yeah. Dr. Marshall Linehan. Yeah, she is somebody I do admire for sure. And in particular, because she is also somebody with lived experience, not of schizophrenia, but of borderline personality disorder and sort of severe emotion dysregulation. And she recently published a memoir where she talked about the experience of being hospitalized for quite a long time when she was an adolescent, dealing with suicidal thoughts, dealing with struggles with strong emotions, dealing with cutting and self-harm. And to me, I just think there's so much power again in people who have had that experience, writing the literature, providing the treatments, and letting people know about what is useful from their own perspective. Again, because of some of the problems we get into when we have too much input from people who haven't been there before personally.
Yeah, that's always been an interesting thing with, how clinicians aren't supposed to share their experience. That's why I think peer support is so important, because you are able to share your experience. But do you think that's changing now to where more people, where the training allows the licensed clinicians to share their experience?
I do think we're slowly moving in that direction. And I think, to me, the reason I see that happening is because of the disability justice movement. People who are really coming out in full force saying like we should not be limited, right? We should have input, we should be stakeholders, we should be at the tables in these conversations. And I think, again, with that shift, as well as some of the more normalizing of just more publicly talking about mental health, just in general, I think that's really shifted our profession. And one of the things, as far as DBT is concerned, is it's a modality that actually encourages self-disclosure. And that's not true for most therapeutic treatments, where we say like there's a real relationship between equals that's happening here, and that means that you share about certain things in certain contexts. And so I really personally resonate with that, because I don't think being a blank slate where I share nothing about myself is really actually that useful to my client, and certainly doesn't build a relationship of trust between us that I think is so critical in doing this work. So I do see that happening. Again, I think it's slow. I really love to see it pick up momentum, but I feel very excited to see kind of that movement happening.
Well, thank you again for joining us for Sandy Says. Make sure you subscribe to our YouTube channel so you don't miss an interview. Have a great day.
Thank you, Sandy. Take care.